When you or someone you love needs a CT scan, we usually just think about the incredible images they produce, right? But have you ever wondered about what's going on behind the scenes? Well, there's this whole world of people and organizations working around the clock to make that process as safe as it can possibly be. So let's dive into that.
So what exactly is this massive safety net? Well, it's not just one thing. It's actually a whole collection of awareness campaigns and safety initiatives. Think of this as your quick guide to what they are, what they do, and the one big idea that ties them all together.
Okay, so the first layer of this safety net is the one that's really focused directly on patients, on you. These are public campaigns that got started because the experts realized that patient safety isn't just a job for doctors. It's about making sure everyone has the knowledge they need.
And two of the biggest names you'll hear are Image Wisely, which is for adults, and Image Gently, which is for kids. Now, this isn't just some minor detail, it's a huge deal. Why? Because kids' growing bodies are way more sensitive to radiation, so they need a completely different, much more careful approach.
So, what does a campaign like Image Wisely actually do? Well, for starters, they created a professional pledge. This lets doctors and technologists publicly commit to radiation safety. Plus, it's a massive hub for educational resources, all driving towards one major goal, always using the lowest possible radiation dose that gets the job done for adults.
Now, Image Gently is even more specialized, and for a really good reason. A child's cells are dividing and growing so much faster, which makes them more vulnerable. So the safety protocols have to be incredibly precise. This means providing tailored advice for different pediatric scans, and just as important, creating materials to help reassure and inform parents.
But these campaigns that are aimed at you and your family, they're really just the tip of the iceberg. The safety net stretches way, way beyond them. It's this huge, interconnected web of organizations working on a global, regional, and even national scale.
And you can really get a sense of the sheer scale of this when you see who's involved. I mean, on the global level, you've got the International Atomic Energy Agency, the IAEA, setting the gold standard. And that inspires these regional powerhouses like Eurosafe in Europe or AfriSafe in Africa. Then you have national groups like Canada Safe Imaging, bringing it all home. They're all working on the same problem, getting the best possible diagnostic information with the absolute minimum risk.
And the real key here is that this isn't some top-down command. It's a multi-layered effort. You've got the global bodies setting the big picture standards, regional groups adapting them, national organizations putting them into action, and professional groups making sure the experts on the ground have everything they need to do their jobs safely.
And speaking of those experts, their role is absolutely vital. That's why you have groups like the American Association of Physicists in Medicine, the AAPM. They created something called the Alliance for Quality CT. Its whole mission is to arm medical physicists. These are the folks who manage the scanners and fine-tune the protocols with the specialized tools they need to guarantee both quality and safety.
Okay, so we've got all these different groups, right? Global, regional, national, professional, all of them pushing for the same thing. They might be coming at it from different angles, but they're all marching towards that common goal of safety.
You have to wonder, right? With this giant interconnected web, is there a single powerful idea that holds it all together? A core belief that every single one of these groups is built on?
The answer is yes, absolutely. And it's a principle called ALARA. That's A-L-A-R-A. It stands for as low as reasonably achievable. And it is, without a doubt, the bedrock concept in all of radiation safety.
Now, this is really important. ALR does not mean no radiation. It means you're always trying to use the absolute minimum amount of radiation you need to get a clear, high-quality image that a doctor can use to make a diagnosis. It's all about finding that perfect, delicate balance.
But a principle like reasonably achievable can sound a little vague, can it? How do you actually put that into practice day to day? Well, that's where this really practical tool comes in. They're called Diagnostic Reference Levels, or DRLs. Think of DRLs as benchmarks, or maybe a better way to think of them is like an early warning system. Let's say a hospital realizes their typical dose for a head CT is consistently higher than the established DRL. That immediately triggers a review. It forces them to ask, okay, why are our doses higher? Is it our protocol? Is it the equipment? It's what keeps them aligned with that core ALRA principle. So, we've looked at the campaigns, the global network, and that core principle of ALARA. But let's bring it all back to the most important person in this whole equation, you, the patient. How does all this behind-the-scenes effort actually make a difference for you?
Well, the payoff is real, and it's direct. Because of all these initiatives, there's just a much higher level of awareness among doctors and technologists. It encourages everyone to use the lowest dose possible, it promotes the best techniques, and it creates what is maybe the most important thing of all, a deep, system-wide culture of safety.
So, if there's one thing to really take away from all this, it's that behind every single CT scan, there's this really impressive multi-layered network of initiatives. From global down to local, every single one is dedicated to radiation safety, and it's all driven by a deep commitment to taking care of patients.
And when you boil it all down, all of this complex behind-the-scenes work leads to something very, very simple, giving you and your family greater peace of mind, just knowing that your safety is always the top priority.
So I'll leave you with the final thought to chew on. The next time you or someone you know is scheduled for a CT scan, how might knowing about this whole global safety net change the conversation you have with your doctor? What kinds of questions might you feel empowered to ask now? Definitely something to think about.